Hello, my name is Kidwell, and I'm one of the hospital pharmacists here at Memorial Hospital here in Jasper, Indiana. And I was asked to provide some information regarding whether or not the vaccine is something to consider as far as for your own health and the health of others. I think the most important thing that you need to consider in regards to whether or not to take the vaccine is when you start looking at all the data that's out there available of the vaccine. The vaccine's been here now for approximately 18 months now, being utilized in clinical trials in about 70,000 patients, and then also now worldwide as far as being utilized in close to 200 million U.S. Americans, and then also approaching close to 1 billion patients worldwide. Whether or not to consider it, you look at some of the, you look at that data, you look at some how effective it has been, and also you look at probably your concerns about whether when you take the vaccine, what are the problems that are associated with it. It is not a medication that doesn't have side effects and adverse reactions, and I want to make sure that you're aware of that. The important things that you look at is you look at the totality of that data, and you look at it not only from the U.S., but you also look at it from other countries. And people are concerned about, well, what's the long-term effects of this particular vaccine, or what are the adverse reactions? And the adverse reactions, there are some there, but when you look at the adverse reactions in comparison to the number of patients, you'll see that that incidence is very small. Then you compare that to the incidence of problems associated with the COVID virus in the populations. When you look at the COVID vaccine in the population, and you look at the serious consequences of that particular virus in the wrong patient, and compare that to the incidence of adverse reactions, I think when you drill it down that way, you will see that the importance of taking the vaccine, not only for your safety standpoint, but for the safety of others, because the COVID virus in the wrong patient can be very detrimental, as we've been seeing in statistics of the deaths and the long-term morbidity involved with that vaccine. So, as I would encourage you to, as we live our motto here at Memorial Hospital, that you be for others, is that when you take the vaccine, it is not without risk, but it's a risk that I think someone needs to really strongly consider, because we all have, we want to protect not only ourselves, but also those who have those family members, those friends, who that virus in that particular patient can be very detrimental to them. And so please consider utilizing the vaccine for the protection of those around you and also yourself.